Hi, it's Rianne here again from Not Just Backs. Now, it's about day 5 or 6 since you've seen us. And if you've had any discomfort following your treatment, this should now really be settling down. If you do have any questions that you need to ask your osteopath, make a note of them now and put them down on a piece of paper and bring them in with you when you come to the practice, because a lot of people suddenly forget what they wanted to say when they come for their appointment. It is really common, so just make a note of those questions. The other thing that we will find that happens is that the osteopath will have a much better idea about your prognosis in the second appointment, because they'll see how you've responded, see how the tissue quality has changed, see your range of movement and see how much that's improved. And they can then work out, depending on the structure that's damaged, to give you much more of an accurate prognosis of how long it's going to take for you to recover. Different tissues that are damaged have different lengths of time. So like a disc and sciatica takes a lot longer, looking at months generally, to heal than maybe just a common joint strain. Now at first they may present very similarly, and so it just gives us that time to see how you've responded, because generally disc strains settle down a lot quicker and take about 4 treatments to sort out. Not disc strains, so joint strains, get it right, Rianne, take a lot quicker to treat. So they take about 4 appointments to sort out, rather than a disc, which can take, you might be up to 12 appointments. And NICE guidelines suggest that, you know, people try manual therapy properly with a disc problem up to 12 appointments before any other referral is made. Now, obviously, we are on the lookout for anything that needs to be sent off sooner, and we will definitely refer you back to your GP if we feel that's necessary and you're not making the necessary improvements. But at the moment we're still in early days, so we'll carry on and see how you're getting on at your next appointment. What research has showed us over the years is that 70% of you will have some form of improvement after the first treatment. So hopefully most of you watching this will have had some benefit. Sadly, obviously 30% may not have, but also you've got the normal distribution curve of some people having that really wow factor, oh my gosh, I feel amazing following treatment, and obviously at the other end of the scale, those who haven't had much change. So we'll discuss this with you when you come in. Another common question we get is about, if you've been given exercises, do I continue them if they hurt? Now, generally after your first appointment, you'll be given exercises to try and create a bit of movement into ranges that we suggest that you try and improve. And this is to help just the fluid dynamics around the area that's damaged or strained. So for example, it's about blood flow exchange in the tissues. So there'll be some articulation exercises. So for example, bringing your knees up to your chest, or some pelvic tilts if it's your lower back. We might also give stretches as well to muscles to lengthen them if they're particularly tight. So if they're sore, then I suggest you do them you just take them to the point of where they're starting to grab. So for example, if we said just to look over your shoulder. Now, normally when we don't have any problems, we can, you know, look quite far. However, if you've got a really sore neck, you'll only go to here. And then you only do that, you feel it bite, and then you bring it back. Or, you know, if you're doing some side bending, you'll only take it to the point where it starts to bite. So it only may be a really small range of movement. So you don't have to really yank your neck around. It's being sensible with the exercises. So just take it to the point of bite and then back again. So that's what we suggest with exercises. What I want to do is to share the screen a second. Hang on, let's get the right bit. I want you to show you our website. You may not have seen this. Let's get it into the screen. So this is our home page. What I want to show you is that we do have a refer a friend. Just going to bring this bit into here. If you like what we do and you have friend or family that would benefit from our treatment, then in your little green pack you'll have a leaflet with it on, so you can just pop their contact details onto that leaflet and then pop it into the practice next time you're in, and then when your friend comes in, then we can give you a little reward for being kind and sending somebody to us. So, but if you don't have it and it's gone in the bin, like things do, you can go on our website, go to refer a friend, and you can complete their details below. So as a thank you for, you know, sending somebody to see us, you will then get a £20 discount off your next appointment once they've been in, and they get a £10 voucher off their first appointment. So it's certainly worthwhile thinking about if you've got a relative. So it could be a child, it could be your mum that you send in, and it's worth getting some money off your appointment, just in case you hadn't heard about that. The other thing I want to highlight on our website is that every week I write a blog. So if you go to this page. Now, a lot of since sort of lockdown, I've been doing little video vlogs actually. And if you didn't tick the marketing box on our GDPR form, then this is the way to get all our information. Now, since lockdown, I have been imparting a lot of information because things have been changing quite rapidly, and all our information to our patients has come out that way. How to wear masks and why we pre-screen and all sorts of things, and when we opened. And it's really important that if you're a current patient, you probably would be better off signing up for our weekly vlog, and then you can learn more about what's going on in the practice. And also I create exercise videos and advice videos as well that might be of interest to you or a family member. So if you haven't done that, then just pop your name into here and your email address, tick the box and then tick subscribe, and you will then get our weekly emails. And also from time to time, we do send out special offers that gives you a great treatment price. So generally about half price. So it's worth signing up for. And then, you know, when you're not a patient of ours, you can unsubscribe, but you might like what I say. So I just thought I'd share that. Let's just stop that share. I'd share that with you before you went this time. So that's all I wanted to say for this time, but I will catch up with you again another day, and a part of your progress and your journey through your treatment. So it's lovely to see you, catch up with you all soon. Take care. Bye-bye.